Nandakumar Sundaram, orthopedic surgeon in MGM Hospital, Malar. We are working here, senior consultant. This thing is about Mr. Vivek, who is now 56 years old. இவருக்கு வந்து ஒரு 5 years பேக் டேமேஜ் ஆயிருந்தது நீ ஜாயிண்ட்டில். இதுதான் கார்ட்லேஜ். அந்த ஆர்த்ரைட்டிஸ்ன்னு சொல்லிட்டு அவங்களுக்கு நீ ரீப்ளேஸ்மெண்ட் பண்ணணும் 2-3 இடத்துல சொல்லியிருந்தாங்க. பட் வி வாண்டட் டு ட்ரை திஸ் பார்ட் கார்ட்லேஜ் டிரான்ஸ்பிளான்ட் பண்ணலான்னு பார்த்தோம். அதுக்கு இதுதான் ஸ்மூத் போர்ஷன், இந்த கார்ட்லேஜ் இங்கே டேமேஜாக இருந்தங்காட்டி அவங்களுக்கு வலி இருந்தது, ஆர்த்ரைட்டிஸ். அதுக்கு நாங்கள் என்ன பண்ணோம்னா, இங்கேருந்து இந்த போர்ஷன்லேருந்து கார்ட்லேஜ் எடுத்துகிட்டு அந்த வெளியே வந்து ப்ரிப்பேர் பண்ணி அந்த ஸ்டெம் செல் அந்த க்ரோத் ஃபேக்டரை இன்க்ரீஸ் பண்ணி விட்டு அந்த எங்கே டேமேஜ் ஆகுதோ அந்த இடத்துல போட்டு விட்டோம். ஸோ ஆட்டோ டிரான்ஸ்பிளான்ட் அப்படின்னா இங்கே அவங்களுடைய ஓன் இதை எடுத்துகிட்டு திரும்பி அங்கே போடுறோம். போட்டுட்டு அதை ஸ்டிக் பண்ணுறதுக்கு ஃபைப்ரினோஜன் வந்து அந்த ஒரு இது மெட்டீரியல் ஃப்ரம் த பிளட் வரும், அது தட் ஸ்டிக்ஸ் த பிளேஸ். அதுக்கப்புறம் அது வந்து இட்ஸ் அ ஸ்மால் சர்ஜரி, ஹோலில் வரையும் பண்ணுறோம் ஆர்த்ரோஸ்கோப்பின்ட்டு. அதனால் 2 ஹோலில் அது போட்ட பிறகு அவங்க ஏபிள் டு ஸ்டிச் பண்ணோன்னா தே கேன் வாக் த சேம் டே. அந்த மாதிரி இது ப்ரொசீஜர், இந்த டே கேர் ப்ரொசீஜர். அப்படின்னாக்கா அன்றைக்கி அன்றைக்கே அவங்க வீட்டுக்கு டிஸ்சார்ஜ் பண்ண முடியும். அதுக்கப்புறம் வந்து கொஞ்சம் ஒரு 6 weeks to 3 months நல்லா ஹீல் ஆயிரும். அதுக்கப்புறம் நல்லாயிரும். ஆமாம். ஆல்சோ திஸ் இஸ் சம்திங் விச் வி வாண்ட் டு இன்ஃபார்ம் த ஜென்ரல் பப்ளிக். இதில் என்ன அட்வான்டேஜ்னாக்கா, ஐ வில் மிக்ஸ் போத் தமிழ் அண்ட் இங்கிலீஷ் ஸோ தட் எவ்ரிபடி கம்ஃபர்டபுள். இதில் என்ன இது அட்வான்டேஜ்னாக்கா, தட் patients who have degeneration, suppose arthritis ஆட்டம் முட்டியில் மெயின்லி ankle or இது முட்டி இருக்குங்க, knee joints, all these things we can now different kind of treatment we started. இந்த இதில் வந்து main advantage is that we can do a daycare procedure in a small arthroscopy use பண்ணி we use the pathology, we sort it out basically. என்ன ப்ராப்ளம்னா, தேய்மானம் இருக்கிற இடத்துல மாத்திரம் we put the cartilage, from the non-articular portion. I will show you in this. இப்போ தெரியுதுங்களா? ஓகே. This is the normal knee joint and the bone is covered with cartilage. And the cartilage doesn't have any pain sensation and it's also smooth. So the movement will be very pain-free and also very smooth without any friction. But once the cartilage wears out, there is a bone exposed. And that bone exposure causes the pain. So if it comes out from the top bone and the bottom bone, when they rub, it's like walking on a broken bone. That much pain will be there. So basically, the cartilage is the most important part in this one, to cover the bone so that it lasts for as long as possible. But when this wears out, when the cartilage wears out, that is causes the beginning of the arthritis. So the wear and tear will continue to become more and more, and it will cause much more defect. And then when it becomes more in the joint, in all the 3 compartments, then there is no other way to treat it. We have to go for a replacement so that bone to bone touching is not there, so that the movement is smooth. That is what happens in a knee replacement, where the surface which is damaged is put with a metal, then another metal covers the top bit of the lower bone, and the cartilage is replaced with a plastic one, polyethylene. So the movement is smooth and they don't get any pain, and also the alignment will be corrected. But this is the final stage of the doing in the arthritis. But before that, if we can preserve the bone, that's what we try to do. Like most places, if the bone is natural and if we can, natural cartilage can cover it, the pathology would be controlled here. So this, several times, it started about 40-50 years back, they started to take the cartilage out and then we tried to put it back. But the culture, they had to do it outside. Take the cartilage from the bone, from the joint, then keep it out and they culture it and make it bigger and grow and then put it back. These are all the olden standard, where 2-3 times the operations and then they needed a lot of crutches and all those things, aids to walk. But here, what happens is, what we do is, this is the weight bearing area. if you see, this one is taking the weight and the cartilage is worn out there. So we take the cartilage from the side of this place, which is not taking part in the weight bearing. So this cartilage is taken and we put it back in the damaged area, and then we fix that with a fibrogen glue, which will act like a glue and it gets fixed there. Then we give the stem cell, which is the PRP can be given as a stem cell, that is a platelet-rich plasma, and these cells have the capacity to increase the growth factor. So this will cover the damaged cartilage, will be covered with the new cartilage we taken from the side, and the PRP will increase the growth of the cartilage, and over the years it repairs the thing. And this is achievement will postpone your knee replacement. Also, if you are careful, it can go on as long as possible. So this we do it with certain patients who are young and fit for this, because every patient cannot be done with this, not that it is a complete change for a knee replacement. The indications are very, very limited in this one. Very important that the joint has to be straight and in the early stages and with the minimal damage we have to do it. So the selection of the patient criteria is very, very carefully done, and it cannot be done for everybody and then it will fail. So we do it for the young patients, active patients and minimally damaged. But our patient who had this, we were waiting for the long-term results. Suppose we do it and 1 or 2 years, if with the PRP and with the changes it may help. But we wanted to wait for 5-year follow-up to present it as it is an alternative in the beginning stage. Suppose if this goes wrong, if you ask what happens next, we have the option of knee replacement. So the idea was to avoid knee replacement as much as possible, because that is the last resort. And if even a knee replacement fails, it can be revised. But we don't want to do anything big. This is a daycare procedure. That means we take a small hole, we make a small nick there and put a scope, which is about 6 mm to 8 mm. And through that we do all the things, how we take the graft and then we place it back in the place where it is defective is there. Other advantage is that we don't need any brace or any walker or crutches or anything like that. We can make them walk same day. They come in the morning after the surgery, after 3-4 hours. It's a daycare procedure, they can go back. Then, but the result, it will take a time, about 3 to 4 months for the cartilage to incorporate, and it helps. And we've done about 30 to 40, 35 patients till now, and we are following up, and we are also publishing it in a journal now. With this is a good one for young and fit, damaged, but those they don't want to go for a bigger surgery and knee replacements and all. We can avoid it in those patients. Here, this patient of ours got it done in the year 2020. So now we got about 5-year follow-up. So we wanted him to tell how he himself he can tell what was his problem and how he came out of that.
I was having the severe joint pain, knee pain from 2015 onwards. Due to my wife's critical condition, I am not able to take severe treatment. After taking the treatment, many hospitals they told that finally after taking their medication, they want to replace the joint. But my condition is I am not able to do that replacement because of taking care of my wife, who she was done in bilateral lung transplant patient before COVID. Then I come to know that one of the friend, he told that Dr. Nandakumar from this Fortis hospital at the time. Then just I came and met him. He advised, he also taken that MRI and other things. He want to maintain the medication. Then after that also, some severe pain. I asked, sir, other hospital told that this age you have to do that better for knee joint replacement, means very easy for future. But he recommended that if you are accepting stem cell technology, he told. But I don't know that the stem cell technology. Stem cell means when the child born at the time, they will take the stem cell, they preserve, that they will do the treatment like that. I heard the knowledge. Then he told that no, that is only one day daycare only. You come in the morning and evening you can go, we will take care like that. Because of that confidence and given by friends only, I accepted the treatment. Then 2020, I taken the treatment. Only one day, morning admitted and evening, and within fourth day I was normal to going to my office day-to-day work. Basically, I'm always traveling and in the site I'm moving, walking maximum time. But now I'm feeling better. I took that around 1 month only, that severe exercise and medication. Then after that, bone strengthening medicine supplementary is recommended. 2-3 years I took, but now I am not at all taking any medicine. Now is okay now. But at the time I was doing that surgery was around 80, 79 to 80 kg. Now I am having 89, but still doctor is advised to reduce the weight for better for sustaining the things. I am trying my level best.